So in order to really honor people's time, I'm going to get started. This is our second meeting with Dr. Joshua Tepper, who is the CEO at North York General Hospital, a past emergency doctor, family doctor, I think, and has done other great things in healthcare in Ontario. So we'll run this the same way we did last time. We will have Jay moderate, and Joshua will give us sort of a briefing, maybe 7 to 10 minutes on where we're at right now. And then we'll open it up to questions and answers. Some people submitted their questions in advance, and so we'll try to start with the questions that come off of our spreadsheet, and Jay will just try to group those questions thematically as he can. And then you can post questions in the chat, and you get your chat, either it's right there on your bottom bar, or if you press more, you'll see the chat can come up, and you can send a message to me or to Jay privately, or post your message and your question for everyone. And again, Jay and I will try to sort of thematically group those questions together. I noticed that Michael Sue is here, and that is a real treat. Michael Sue is one of the first presidents of the board at Paul Penna Downtown Jewish Day School, and a longtime friend. So it's just so nice to see her there. She just happens to be on my front screen. So thank you to everyone who's here. I see kids in the background. This is lovely. And I'm going to turn it over to Jay and then to Joshua to get us started. So thank you, everyone, for joining us.
Thank you, everyone, for joining us. This is round 2 of this type of conversation, and it was the first one. I know I personally found it really valuable, and I hope others did as well. I know they did, because many of them are back. It seems like that took place a very long time ago, even though I think it was 2 weeks, but perhaps some of the longest 2 weeks of our collective families spending together. Dar and I counted up earlier that I think it's meal 48 in a row, eaten around the same table, 46 of which we cooked ourselves. So we are putting some interesting matrix around this for sure. But I want to welcome Joshua and thank him again, and welcome all of you. And thank you all for being here. Joshua, maybe if you want to start with a few words sort of by update of maybe where we've been over the past 2 weeks, any new information we should have, and then we can jump into questions if that's okay with you.
Yeah, so thanks very much. It's nice to see everybody, and I hope people are doing well. You know, I think as always, the value of these is the conversation and the questions. In some ways, things are very much the same. In some ways, things are changing dramatically. I think, I forget exactly where we were 2 weeks ago. I don't know if we'd quite declared emergency measures. We were conceptually socially distancing. We closed schools. The bottom line is that the virus has continued to spread very rapidly. We're starting to see a real escalation of that curve across the province. We're starting to see more significant localized outbreaks. At least 10 long-term care homes in the province have started to have had significant outbreaks. And we're starting to see, unfortunately, the death toll rise and the hospitalization rate rise. Hospitals are deep into their pandemic planning and actually are now starting to think about actually moving from planning to operationalization of extended capacity, particularly around ventilators and inpatient beds. You know, it's hard. I'm a hospital CEO, and so, you know, inevitably I'm a bit slanted by what I do every day. But basically, the hospital system has stopped doing everything it doesn't have to be doing to empty our beds out as much as possible, to create as much room as possible. In the early days of this, what we see is a lot of mild disease, and there'll continue to be mild disease. But as it goes through, as more people are affected, inevitably you'll start to see the more serious disease. So again, if, and I don't want to repeat too much from last time, lots of the same folks, but again, if you remember that, you know, 90% plus are going to have very mild disease. If you only have 100 people with this disease, then, you know, 90 of them are fine, and only 10 people need to sort of be thoughtfully looked after, and only sort of 2 to 3% of those are going to end up in an ICU. But when you start to think about thousands of people being affected, those numbers start to go up. And so what we'll start to present to our emergency room is a lot It's not that the disease is more severe, it's that there's more people having it. So just by nature, there's more sick people. You know, again, you know, there's just a lot more community spread. So I guess if you're going to take one lesson away, that, you know, everything you've been practicing about social distancing, now is really the time to quadruple down on it. Because before, if you were social distancing, you're doing the right thing. And if you broke social distancing, the odds of you getting sick was actually relatively low, because the disease spread, the community-based transmission was not that high. Now, when you're out and you're breaking social distancing, actually there's a lot more disease community-based presence. And you're just going to be at much higher risk because there's just that much more virus permeating the broader society. And that's why this talk about, you know, have you traveled is irrelevant anymore. This is now community-based spread. So I think that's sort of where we are. We're certainly not at the peak. I think, you know, to anticipate that question, you know, depending on the modeling, you look at the peak is sort of a couple weeks away at the outside. You know, and it won't hit evenly everywhere. There'll be, you know, nobody would have said Bob Cajun will be our first hotspot with, you know, huge numbers, right? It's going to pop in ways that are unanticipated, but overall that's going to be building. So why don't I, you know, again, the value's in the conversation. And so why don't I turn it over for questions as best I can.
Thank you, Joshua. Helpful. And it is hard to think back 2 weeks ago where we were and even the questions we talked about. But one of there are several questions around the idea that we have all in some capacity been social distancing. Some people been either in self-isolation or in quarantine. Some of it is about the risk of like going grocery shopping, and even if social distancing is employed there, what are the relative risks of that? And if there are other people who have been doing the same type of social distancing or social isolation or quarantining, is there increased risk? Should we be seeing them? Right? Is there a way to open this up a bit? Is some of the questions to be with families or people who have been doing the same thing you have without symptoms for at least 14 days?
So on that question, like the answer, like right now, just has to be no. Like this is not the time to open it up. In fact, this is the time you just don't want to open it up. And it's hard. We're heading into Pesach, right? And we're heading into family time and everything else. But the answer is like, just absolutely not. Like we have to quadruple down. Like I said, it was almost practicing before, because the level of community spread was not what it's going to be now. And so before you could sort of say, I'm cheating a bit, but the odds of getting caught or getting sick is pretty low because there isn't that much community spread. Now we're going to have more and more community spread. So the odds of getting caught or sick by cheating on the social distancing is much, much higher. And so it's really important to realize we're just, as this community spread is much more prevalent, it's a huge issue. So the answer is really no. On grocery shopping, you know, we all need groceries. There are a few things about groceries. So first of all, try to, you know, there's been a lot written, but here's a few highlights. One, shop as little as possible. So try to shop for at least a week at a time or 10 days at a time. I'm trying to shop for 3 or 4 families when I go out so that not everybody's getting exposed. So minimize the numbers. Try to shop at off-peak hours. Don't bring your own bags. They shouldn't be allowed. Good grocery stores are not allowing it. I bring my own Purell. I wipe everything down as I go through, everything as I go, you know, I touch, you know, as I move through. I try to just Purell constantly throughout the store, starting with as I enter, touching the cart, moving through the place. I try not to touch things unless I know I'm going to want them. You know, buy whatever you normally buy. Do not do any hoarding. We don't have any real supply chain issues, so don't hoard. There's mild, you know, you're having a hard time finding Lysol or whatever, but for the most part, there's no need to hoard. We don't have supply chain issues. And really, most countries that are going through this are not having supply chain issues. We're having ventilator issues because people aren't social distancing, but we're not having supply chain issues or core infrastructure issues. So when you get home, you know, there's a very good video. I think in the interest of time, I'll circulate that video. It was put out by a family doctor in Michigan. It's about 13 minutes, and it's just a nice, it just talks you through how to deal with your groceries or your Uber Eats in a very methodical way, and really sort of protect yourself with what you buy. And again, just throughout, it's really hard, but try not to touch your cell phone. And often we keep lists. So I've tried to start switching from my cell phone list to a paper list, and try not to touch your face, because inevitably as you shop, you're touching lots of things, you're bumping into stuff, and you touch your face, and that's really the risk. So I bring small Purell, go right through, and then just really try to avoid touching your face. And again, when I come in, Sophie's done some shopping. I happen to have been doing some of it. I really like, it's sort of a quarantine with my bags onto the counter. It's my space, my time to unload. And then I'll send this video around that really talks about how to deal with different types of things that you purchase.
There was a bunch of questions around that front.
Okay.
Another,
I can answer them now if you want.
No, I think that actually answered several of them. Another sort of theme of the questions is about symptoms, and how do you know if the symptoms are part of COVID-19, and should you self-isolate if you have one of those symptoms? And then if you have had some of these mild symptoms, how would you know that you've had it already, and are you immune to it again?
Right.
A lot of questions.
It's hard because the two symptoms we really know about are cough and fever, and then more significantly, shortness of breath. And so those are the classic symptoms, and you don't need them together. Cough alone, no fever, fever, no cough. Very rare to get shortness of breath without a cough, but it could happen. There's some stuff circulating around diarrhea and gastrointestinal. It's not for sure, but part of what's happening now is the disease spreads more and more, and people have asymptomatic. They've got a little bit of fever. They're not thinking they got a mild cough, and then they get brutal diarrhea. And so they go in, and so the causation association just gets harder and harder as we start to see widespread prevalence of the disease. But there's some conversation about GI stuff. There's been some well-noted papers, but very small numbers about loss of smell, a few things about headache. But again, it's sort of, the things we're really watching for are cough or fever or shortness of breath. In the vast majority of these cases, 90% or so plus, the symptoms are all mild. You just immediately have to isolate from all others. And it's, you now move from social distancing into self-isolation, and not just self-isolation, but self-isolation with symptoms. So if you came back from a trip, you should self-isolate. Or if you're in contact with somebody who is positive, you need to self-isolate yourself. But as soon as you are symptomatic, it's a whole nother level of self-isolation, because now you should not be, if everybody comes back from a trip, you have to be in 14 days, but together you can all hang out, blah, 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 blah. Hang out, share dishes, share food, share bathrooms, share garbage, not a problem. As soon as you have symptoms, you're able to transmit the disease. And that's really when you go into a true self-isolation, where you shouldn't be sharing bathrooms or not at the same time. Everything has to get wiped down, paper plates, laundry has to be carefully done, everything. You're really separating into a self-isolation as opposed to a group isolation as a family, as soon as you have symptoms. In terms of what happens afterwards, we don't know yet enough about immunity. We certainly think that there's some immediate immune response. That's why some of the new therapies with plasmapheresis are taking antibodies of the recently ill who have developed these antibodies, and it seems to be effective. So there does seem to be a period of immunity. The problem is, because we're not testing everybody, we don't know if you had a common cold or a COVID. Now, chances are if you had a sore throat and a runny nose, that was just a common cold. Don't go out. You're going to get COVID. Like a runny nose and a sore throat is not going to be COVID. And if you think, oh, I just had my COVID, wasn't so bad, you go out, you're going to get COVID. What you had was a coronavirus common cold. So that's the, and in terms of long-term immunity, we just don't know. Herd immunity, lots of things we're playing with. We can get into second wave probably. I'm sure somebody will ask about second wave.
We'll hold off on the second wave. We'll stick to more practical advice we can give right now. There are a lot of bubbies and zadies on this call, but also in our thoughts as we sort of thinking about how we're going to get through the next period of time, including my parents who are in a car on the way from Florida to Boston this very second. But what should we be telling our parents, even if they don't want to listen, about should they be staying in? There was just a new directive imploring folks over 70 to not go out at all. What should we be talking to our parents about?
Yeah, I mean, the CDC put this out about 70-year-olds a month ago now, right? Or 4 weeks ago. So we're a little slow. The CDC, the Center for Disease Control in the US, put this out. They actually defined old as 65, which many people found personally offensive. But yeah, it's it's really, really important that if you are older, you have to self-isolate just religiously. Like you are not necessarily more likely to get sick, but you are more likely to be severely sick. Yes, we're seeing data from other jurisdictions about young people as well and hospitalization, but let's be clear, the vast majority of the people who die from this are above the age of 70, period. So yes, there's 26-year-olds who die, but the majority of people who die are over 70. And that's just the nature of this disease. It's the nature of influenza in general and other types of pandemics, but this disease in particular. And so we have to be obsessively, lovingly distant. We have to help our elderly people in our community and the older people in our community. Nurses, like we have over 70 nurses, they're off, over 70 doctors, they're like gone. Like this, that's not out. And so you cannot overspeak to the need to protect the elderly. I can tell you in my hospital, the people who've died, they're over 70.
Yeah. Can you speak, because we touched on it 2 weeks ago, and there's been lots of both conspiracy theories and just people who think they know things, that you talked about this being transmitted by droplets on hard surfaces. There's been lots of conversation about it, is it in the air? And I think the common conversation recently has been about, should we be wearing masks when we're out doing things? And is that effective for stopping things entering our system, or is it just so we don't touch our face?
Yeah. So this is a droplet-based disease. The only time it really becomes aerosolized is when you're doing highly intensive certain medical procedures that are in a very contained way, which nobody on this call will be doing unless you're a physician or a respiratory therapist or something. But nobody in common contact in day-to-day life outside of an operating room or intensive care basically is going to be facing aerosolized coronavirus, COVID-19. And so this is for everybody who's not outside, like even in 99% of my hospital, it's a droplet disease. There's only tiny parts of my hospital doing specific procedures where aerosolization is a real risk. Bronchoscopy, intubation, extubation, things like that. So this is a droplet-based disease, number one. There was one study out of the New England Journal where they talked about it being aerosolized, but there's been a lot of criticism about how they did that because they used a special machine to pump it into the air. It's not really representative of how most people breathe and interact. And so a lot of people, there's some parts of that study that are accepted, but the aerosolized part is not. And so it is, to all intents and purposes, for routine, a droplet procedure. So that leads to the issue of masks. And the answer is no, you should not have masks, because here's the thing. Masks are helpful to stop you from spreading disease. But if you have any symptoms at all, you should not be out. Masks will not protect you from getting the disease. It will help you from spreading it. Now, there are people who are immunocompromised or whatever. Jennifer Keesmaat, the city planner, had a little Twitter meltdown the other day on this issue. There are certain people who are very immune compromised, and they're wearing masks because they're not healthy overall. But the vast majority of us have normal immune systems. The masks are not going to protect you from COVID-19. If you have any symptoms at all, the only time you should be wearing a mask is if you get symptomatic and you get very short of breath and you have to go to the emergency room and you can't drive yourself, you should wear a mask to get to the emergency room, because now you're deliberately exiting the house with symptoms. So you're putting other people at risk. If you have symptoms, don't go out. And the reason this is so important is because we don't have enough masks. There are not enough masks in North America, and there's probably not enough masks globally. And the people who need those masks are the people who are at the front lines of care. And the more we see, if I can use this word, civilian use, non-frontline use, it is a massive issue. So please do not use masks. If you have symptoms and you need to go to the emerge, great. If you have symptoms, don't worry, go out with a mask, stay home until you're better. And if you're deeply immunocompromised, there's very few people like that. But if you're on chemo or something, fair enough, you're one of the rare exceptions. But masks should not be worn. They will not keep you safe. And if you're sick, don't go out with a mask, because you're going to use it wrong. Here's the problem. You're going to use it wrong. You're going to touch it. You're going to pull it down. You're going to touch something and touch your face. You're going to compromise your mask within 30 minutes at the outside if you're normal, and 45 minutes if you're moderately obsessive. It takes days of training to learn how to wear your mask properly. And you're going to waste and burn them through, and you're going to use them improperly, and you're going to get sick. My favorite was the guy who came into our merge, took his mask off, put it face down beside him, took a bunch of Timbits, ate all of his Timbits, wiped his hands on the products around him, reached down and put his mask back on. Great.
He didn't have the training.
Nobody's going to have the training, and he didn't need it in the first place because his presenting symptom wasn't a respiratory symptom.
Right. There is a really thoughtful question, and I'll try to break it down.
All thoughtful questions.
Good. The idea that, here, I guess I'll sort of read it. Given the revised downgraded projection of morbidity by Neil Ferguson from London's Imperial College and our very selective testing of COVID patients in Canada, how do we know that our approach to social isolation will work and is advisable when mortality rates vary widely in Europe? Some are on lockdown and some are not. And the negative health impacts and increased mortality of isolation and poverty are well documented. So are we doing the right, what are the implications of what we're doing, and will we know that we've done the right thing? As well, are people sort of other medical procedures not being done because of the sort of social isolation?
Yeah. So there's two separate parts. I'll try to remind me about the second one later. So first of all, we don't know for sure that social isolation is working, but it seems to have some benefit, and it's the best thing we know right now. And so first of all, you can't be guided by the mortality rates. The mortality rates, the problem with the mortality rates is that you don't know what the denominator is. Even in Canada, we can't, it's hard because we keep changing our testing criteria because we don't have enough swabs and we're not testing in a consistently sampled way. It's really hard. The mortality rates are probably much closer to each other than they look. Obviously, this isn't SARS and this isn't MERS. We're not seeing those types of high mortality rates except among the elderly. But the point is that looking at those mortality rates are a bit misleading. Canada's mortality rate is clearly going to go up a lot. And as a percentage, it's very hard because you only know what you test. And so you don't really have a correct denominator is the problem. So there's a lot of temptation to find ways not to, or to argue ourselves into not socially isolating. It seems to be the best evidence we have now. Will we learn more down the road? Maybe, but I think right now, there's early evidence out of Seattle. There's some good evidence out of BC this week, Seattle this week, that actually social distancing is actually starting to flatten that curve. And so, yes, there are absolutely detriments to social distancing, loneliness, social isolation, all these things for sure, absolutely. But it seems to be the best option we have on the current available evidence. And there is, there's more evidence to support it than against it, but it's early days. And there's a lot of evidence that so not socially distancing leads us to places like Italy and New York.
Thank you.
something about a hospital. There's a question about the hospital at the
Oh,
end.
so people, and actually come up another time, people are sort of pushing off either doctor's appointments or procedures because they can't go, or the hospitals don't want them, or they've been canceled. Are we running a risk of those people becoming sick with something else or not well because they can't get their things done?
Yeah, I mean, I think, first of all, if somebody has critical healthcare needs like chest pain, like I said this last time, people will continue to get sick. And if you're sick, you need to find a way to access care. As much as possible, we should be running virtual clinics. I just saw 11 patients virtually. One of them will need to come in tomorrow and get seen physically. And so, 11 phone calls, one needs to come in. About the same last week. And so you need to still continue to access care where it can be done virtually, great. Otherwise, come in. We have basically stopped hospital-based procedures because we are making room for what, by all accounts, will be an overwhelming visit level of very sick patients, and we need the capacity. And so people should continue to access care. If you need to go to the emergency room, please go to the emergency room. Nobody should stay home with crushing chest pain, fever. If you're sick, please get care, especially if you're short of breath.
One question specifically, we've talked about sort of over 70 for sure, but we've all seen the news that it's affecting everybody, but that's sort of the highest risk factor. What about the very young? There's a question here about a 2-year-old, but you've been pretty clear we should be not seeing other people anyway with symptoms. We should be self-isolating from our families and all those things. Do we know anything about the risks of other age people, young or old?
Yeah, so I think we know that kids absolutely get it. We probably dramatically under-test in kids because we're so used to them having coughs, fever, sniffles, and colds, and because we don't want to take them in to a place where we think they're going to get sick, which is wrong, because you're actually more likely now to get sick and always have been in the community. And because we don't like sticking swabs up kids' noses because they cry a lot. So we actually underestimate the disease burden in kids. We know they get it. Fortunately, they don't seem to get very sick from it. The cases of kids under 18 getting ventilated or dying is exceedingly low, but they're unbelievable vectors. As we know from less serious things, they can absolutely catch it and they can absolutely transmit it. And that's why contact among kids is such an issue. There's talking about opening daycares and stuff for healthcare workers. Most hospitals are saying, we heard the government's doing this. We're deeply anxious about the government's decision. Please try, if at all possible, not to use these daycares. We're extremely anxious about this decision.
Question. I mean, this is really sort of over the next time. If the city imposes more lockdown measures or stricter enforcement of measures, how does that affect people who need to, take care of their parents or see their parents to get them food or drop by groceries? I think.
Yeah, I've seen, who knows where we'll go or what we'll do. I don't know of many jurisdictions, ultimately people are going to have to facilitate normal activity, right? Not normal activity. People are going to have to really still be able to provide essential services, and caring for whatever, caring for a loved one, caring for a frail is an essential service. I think what I would say is the less often you can visit in person, physically visit. Virtual visits, hours a day. My kids spent 3 hours reading to my parents, to their grandparents. They spent 3 hours reading them books on the weekend. I'm not sure they wanted all 3 hours, but anyways, they got 3 hours. Virtual visits, we should be doing more and more and more virtual visits, touch points, whatever. But physical face-to-face, you should be aggressively minimizing it. And so again, if you're bringing food, try to bring food that can last for 2 weeks. Try to bring food that won't go stale over 2 weeks. Try to bring them in ways that are easy to clean and products that will keep them safe. buy stuff that you can leave in your own garage for 2 days so that or a day, the virus is more likely to die. Like, there's just things you can do, and give them as much as you can to limit that need for risk. And again, this isn't going to last forever. It's going to last longer than we like, but we're heading into it. And I read isolated people, but my views are shaped by the preponderance of the evidence. There's, you talk about Ferguson or whatever. Yeah, there's rare people who have these different theories. What I'm sharing is what I would argue is the preponderance of where the evidence and the thinking is. There's always people who think we haven't landed on the moon or whatever, but what I'm sharing is the preponderance of where the evidence and the thinking and the policy direction is right now.
That's helpful. Want to ask another question. So we talked about, if you have symptoms, self-isolate for real, don't go out, separate yourself from your family. What happens if and when those symptoms go away? What would be the timeline to get back to normalcy, or is there a good timeline for that?
They're saying it's hard. It's really tricky right now because the evidence is not consistent. Like, I'm seeing different things from different places, even within Canada a bit. So I think what most people are saying is you have to stay until your symptoms are fully resolved, plus another 48 hours. And there has to be a minimum of 7 days. I think some people are saying 14 days total. I was talking to somebody today, but and the CDC, some people are having even more aggressive, but at least 7 days. The symptoms then have to be fully resolved for at least 2 more days. But it is tricky depending on where you go.
Thinking about from a society level and what it means to this community, but sort of all of the province, we've gone from March break plus 2 weeks, which brings us to the end of this week. They've extended it to the beginning of May 4th, I think it is. The mayor of Toronto just canceled mass gatherings through the end of June. Do you think May 4th, which is the next date that has been sort of talked about from the province perspective, do you think that's realistic? Is it too soon to tell? What are your thoughts on that front?
It's too soon to tell because we don't really know how effective the social distancing is going to be in flattening the curve. We just don't know yet where we'll be on that curve, what that curve will look like. Personally, for me, I think it's too early. I've been looking at some of the modeling. I don't know yet. Could I imagine that different parts of the country get through it easier or later? Again, this doesn't, even the countries that have been decimated by this have been unevenly decimated, like Italy, which, people say, oh, they don't have that many people dead. Yes, compared to the US. But again, this is why the people play with these numbers. Oh, the percentage of death. Well, you don't know the denominator and you're not looking at the size of the country. So the US has more people dead, but it's a huge country compared to Italy. So anyways, lots of things to think about in how people use the stats. But the point is, even in Italy, parts of Italy were relatively lightly touched and other cities were just decimated for a whole bunch of different planning, structural, age distribution reasons. So could I see different parts of Canada getting out from under emergency measures at different points in time? I could, because the virus will work through it in different ways. And then you get into the issue of second waves.
Can you get into that issue just for a moment? Because it did come up at the beginning, but thinking of second waves, yeah. And I think we've done our research about the Spanish flu of 1918, which seems like a weird thing to research for me, but yeah.
Nobody knows for sure. But there is an anticipation of a second wave. China is doing a lot right now to try to limit second waves in a lot of ways. People are fairly confident from what I read saying that if there is a second wave, it will be milder and shorter. It will be less severe in terms of number of people affected because a whole bunch of people will be immune by that point. A lot of the people who are most vulnerable may have died, which is an uncomfortable, unpleasant thing to say. But certainly there will hopefully be some herd immunity. Hopefully our capacity and our response will be quicker. So we don't know for sure there'll be a second wave. Some people think this could just mutate out. Some people think there could be a seasonal component and that just the warming of the weather will take care of it and we won't have a second wave. So we don't know for sure, but there's a lot of anticipation of it. And even countries like South Korea and China that are sort of through it are staying quite braced and keeping a lot of restrictive measures partially in place to limit the severity of a second wave. They can't limit it from coming, but limit it to severity. And we don't really know if you're fully immune. Somebody's asking, we think you're going to be immune, but we don't know for sure yet, right? And we may be immune for this season, but we don't know quite what the future of this holds. So we think there's some at least short-term immunity.
Two quasi-related questions. One is, if you're not seeing symptoms, like risks of a daily walk, with your family or just sort of the grown-ups, and sort of keeping your distance on the sidewalk. That's sort of one question. And the related one is, when you come back, is there risk that it's on your shoes, for example?
Yeah. So absolutely, people should get outside. If you're symptom-free, you should get outside. Really, people need to get outside. But like you say, you don't want to go and hang out. And when you see your neighbors, run over and give them hugs and all that stuff, or stand really close and catch up on how hard this has been. So yes, get outside, play in your parks, play in wide open spaces, go out at different times than other people, and absolutely get outside. The issue about, take your shoes off is probably a good idea. There's more and more discussion, and we're having this in hospitals, if everybody should be in scrubs, change into scrubs, wash them at the end of the day and stuff. In the US, the anesthetists in high intensity areas are showering after every intubation and seeing every critically ill patient and changing and showering. I think for the average person on the street, it's not clear to me that if you simply go out and walk around and come back, that other than washing your hands and taking off your shoes, you should be fine. That, from what we can tell.
Looking through questions. And some folks are, and I don't, this is not a criticism, some folks are asking questions that we got to at the beginning of the program. And so I think what we'll do, Amy, correct me if I'm wrong, we're recording this now, we can push it out afterwards as well. So it'll be a good time to sort of get to that. And here's a question that came up a number of times, and Joshua, you've promised to send a video around it as well. But thinking about takeout food, because I know that's top of people's minds. Is there a worst, better, best scenario of what we should be having, or just
hot over cold? Hot food, or food that can be reheated, and you don't have to fry or broil your food to death, but hot over cold, or food that can be heated in the microwave is much better. Have the food dropped off outside. Have the person step away, if at all possible, like prepay and all that. Have them step away. Try to get, the way I sort of do it is, I try to, outside of the house, take as much of the packaging and everything off out there, all the bags, all of that, lay it out, get that all straight into the garbage outside. Wash my hands, because that's now said, so that's my assumption is, okay, maybe the person who delivered it is infected. So I've taken the outside peel and I've done all that, I clean. Now I take the containers that are holding my food inside alone. I have a clear spot on the counter with no other dishes or anything. I wipe down the outside of the container with Lysol, the styrofoam container or whatever. So I wipe down the outside of those containers. I'll open those containers and I will decant them onto the plates. And then I will dispose of those containers, wipe the counter where they were, wash my hands. Now I have the plates that were clean and the food that was decanted. So now I've said, okay, the person who delivered it, I've dealt with. The person who packaged it, I've dealt with. Now I have to think about the person who made it. That's hard. But again, if you've done something that's heated, you pick up the plates that are clean with the food that you might be worried about, put them in the microwave, reheat it, and you've sort of taken each step.
Well, that's fun. I'm just kidding. But that is helpful. I think that actually answers a lot of people's questions about how they've been going about their day.
It's actually why your approach, Jay, of making as much of your own food as possible is actually, it's inconvenient. And I haven't done a lot of that, to be honest, but it's something, it's sort of advantageous in a way.
Yeah. question, I guess the question that's not here, but we've been thinking about a lot, and certainly anybody who's been on social media. Joshua, for you and your team and sort of healthcare professionals, what can we do to help you do what you're doing? Yeah, how can we help you do what you're doing without getting in your way?
Honestly, like, I'll just say two things, I think. One is keep yourself from getting sick by hand washing and not touching your face, number one. Number two is keep other people from getting sick. And listen, I'm very sensitive to the question asked earlier about does social distancing really work and a couple, whatever. It is our best bulk of evidence and policy approach. So please try it. Like, just please try it. Like, it's all we've got. There's not that, it's not that we know for sure, but it's the best evidence that we have. And so please don't get other people sick, socially distance. So keep yourself healthy. Don't get other people sick and put them at risk. So socially distance like crazy. And then I think the other thing is like, people just appreciate thanks. Like, you all know doctors and nurses and everybody. Like, it just, it's sort of, and, just say thank you. And I would say, you all know nurses and doctors. I'm lucky, I'm a CEO. I don't need a lot of thanks. But the people who are out there at the front line do. And I can tell you, I was at the grocery store this weekend, and, those are front lines. Like, I think we all heard about the grocery person who died, 20-something years old. Like, I just said, hey, I really appreciate you being out here today. And she basically started crying. And like, we forget how much stress being at home and socially distanced is stressful, but actually having to have a job that's in essential services like grocery stores and being on that front line, that's super stressful. And just giving people a little bit of an acknowledgement of that. If you know a nurse, give them a call, give them a phone call, give them a text message, send them an email. I've had more random people in my lives on LinkedIn and whatever reaching out saying, hey, I think you went into medical school. Hard to believe they let you in. If that's true, according to your LinkedIn profile, A, probably they shouldn't let you in, and B, take care. Like, people I haven't seen since high school, right? And so like it matters. And so I just think those types of things matter. But basically the most important thing you can do is don't feel the emerge by doing things that make yourself and other people sick. Because we're going to run out of ventilators, and that is going to be horrible. Running out of ventilators is going to be horrible, horrible, horrible. So don't let it happen. Even if we're not sure it can work, let's try it.
That's good advice. Someone had a question. I don't know who, but what does it make sense to buy a pulse oximeter to help monitor lung activity?
No. If you're short of breath, you'll know you'll be short of breath. If you can't breathe, come to the emergency room for any reason. It doesn't have to be COVID. If you can't breathe, I want to see you. Doesn't matter why. If you can't breathe, we should see you. And you're trying to guess 93 or 92. No, you know when you can't breathe, and we want to see you no matter what.
Sorry, I'm just trying to find new questions because I'm taking them out of order, which is my fault. Some good advice about reading to your grandkids on Zoom. Maybe not 3 hours at a time, but sometimes. Two questions. One, you talked about ventilators, and that's sort of part of the answer. We've seen that sort of unfold, certainly in the US on the biggest stage for sure. But speaking, I don't know if you want to speak directly about your hospital, but about Toronto in general, like, where are we in being able to handle the cases we think we will see in either sort of a small, medium, or large type of a model?
We're working very hard to be as ready as we can be and to dramatically expand the capacity we have now. I'm going to leave it at that.
Fair enough. I'm just looking. Oh, hold on. Seeing if questions have come in. Amy, am I missing some that I should be seeing? I'm sorry.
I think we're almost done. I mean, I was put in a question. I think we're sort of coming to the end of the questions. And so I think that, if there's another question or two people have, please put them in quickly. And then I think we're going to really be respectful of everyone's time and of Joshua's time, and try to wrap this
The
up
other
soon.
thing is, if there is a couple questions that we covered earlier, I've got another 15 minutes. People can drop off, and I'm happy to re-answer. I don't mind that.
So I think that there's a point at which we need to ask and answer the question again around, if my family's been social isolating and your family's been social isolating, and we know we're all well, can we get together? So I know you answered that at the beginning. It's come back again a few times. So we might want to just hold that question and answer it again at the very end.
Sure.
There's a question here around why are we seeing so few cases in BC? So why are some provinces seeing it more than others would be a theme of some questions. And then, I asked the question about mental health. Are we seeing an increase in anxiety, depression, mental health issues coming into the ER? And how is our healthcare system dealing with that?
Yeah, so I think, one of the good things I'll say about mental health is, at least we're talking about it.
Mm-hmm.
At least we're trying to address it. I think there's no doubt that mental health issues are spiking among everybody, healthcare workers, people who are at home, people who have to, there's no place that it feels not stressful. If you're isolating at home, it's incredibly stressful. If you're at a frontline grocery store with hundreds of people going by you, who, coughing and talking to you and all that, it's stressful. If you're on a streetcar going to work, that's stressful as you touch everything. So, there's a lot of, there's no place that isn't feeling stressful. And so, yes, it's going up. What's good is we're talking more about it. There's a lot of online tools. Psychiatrists and psychologists are doing virtual visits. Our digital capacity is there. The online capacity is there. The Big White Wall, Bounce Back are two youth-oriented and online tools. There's a lot of online CBT. There's just a lot more capacity and resources that are happening, and so at least there's access that wasn't there before, and there's much more ability to talk about it. I think 10 years ago, nobody would have asked that question. Somebody might have thought about it, but people would have been less likely. And now there's so much being talked about and written about it. This is an emotionally stressful time for everybody, regardless of what you're doing. And I would just ask people to reach out. I mean, if you or somebody is having a hard time, that's to be expected. But just because it's expected doesn't mean it should be ignored. And so I absolutely want and encourage people to, if you need, reach out to me, reach out to your family doctor, reach out to me if you don't have a family doctor. I'll get you one if I can. There's free online tools. Many of us are fortunate to be able to afford a subscription for some of the online CBT. There's some stuff out there. And if you're very unwell, please come to the Emerge. Sorry.
Joshua, may I ask you a question? Because we know you for a long time, and wanted to see if there's been some, like how the homeless and most vulnerable population in Toronto and around the country are dealing. Has there been cases of COVID among sort of homeless populations here in Toronto? And I guess how do we sort of help with that?
The people in prison, people who are homeless, are my number one worry in a way. I mean, not my number one, but they are populations outside of the elderly that I deeply worried about. They can't socially distance. They've got so many comorbidities. They're so, they're fragilely housed. They're highly transient. I worry deeply about it. So yeah, it's something that I spend a lot of time. The cities agreed, or the provinces agreed, to send up some shelters. Some really good friends of mine. I keep my clinic going on Monday nights. So we're doing what we can to set up shelters for persons under investigation. That's one group of people we should overscreen as a population, etc. So it's a great question. It worries me tremendously.
Thank you. And I know you've been thinking about that. one note, speaking of sort of mental health and both our own and our families and our kids, want to mention that Francine's been doing excellent work and is available to families at school. So reach out to her as well. One last question, and then maybe you can get to the sort of last social distancing rewind or redo. Do we expect, and have we seen across the world, outside temperatures playing a role in the spread of this? Or stopping the spread of it?
Temperatures?
Yeah.
We don't know yet. It's one of the theories, one of the hopes is this will have an influenza. I mentioned this last time, like this could go one of three ways, right? This could sort of become SARS, where it just sort of burns itself out and we really don't see itself again. This could become influenza, where it comes back on a very cyclical pattern right across the world, right? Remember, influenza starts over in China, they rush to test it, they get the vaccine, it works its way across and we get it, right? So this could become the new influenza seasonal, or this could be the common cold, which is always somewhere in society. Some, you get 50 people, somebody always has the cold, right? And so it could just fall into a bit of a basal level in society, and with a slightly higher fatality rate perhaps, but it could just be one of the, or like pneumonia, some of the pneumococcus agents that until we get a vaccine, continue to percolate along in a certain percentage. So we don't really know, will this completely disappear? Will it become an annual cyclical thing? Or will this just become a basal level in society, at least until we get a broad-based vaccine?
Sorry, I keep not unmuting myself. I want to be respectful of your time and folks in this call, and you've done both important work and yeoman's work, both at the hospital and certainly giving your time generously to us here now for the second time. I think, Amy, if it's okay, we're going to give Joshua back his time, and I think we've gotten to a lot, or maybe all of the questions, and we will say goodnight to Joshua.
Like Amy's sent my phone number and email out before. A lot of you have it because I'm on school list. Just send me a text and I'll call you back. Several parents have done that. We've had good conversations, and yeah, don't hesitate. We should chat about these things.
From a distance.
From a distance.
Everybody from a distance. I think that's the number one takeaway. Keep things separated. Yeah.
And that's, for now. That's again why I just say people have been socially distancing. We socially I guess, you can imagine some perfect scenarios where maybe you make the decision to get together. But, everything's a risk, right? So, somebody could say, why don't we get together with your family? You're responsible, you're not. Let me be clear, like I socially distance aggressively, but I've been out and about, as have my wife. So, so let's, my sense is that for the most part, it's hard to really maintain. And so the more you mix and mingle, that increase is just going to go up. And then you put a couple of elderly people in and it goes, because it might be totally unconscious. It might have been the food delivery person. It might have been this, and you think it's what we're seeing right now. People say, well, why are people wearing masks in hospitals? Well, what we're seeing is that even over the course of a 12-hour shift, somebody may come up feeling fine. They come through the door, they're 100% fine. 10 in the morning, they're like, huh, do I have a bit of a fever? No, it's probably just hot in here. It's hard with the mask. I'm running around, just whatever. They're like, I'm fine. Oh, maybe, no, I've only, and then by 3 in the afternoon, they're like, maybe that's a fever. I'm not sure. Yeah, it might be. I've only got 3 more hours left in the shift. And you go home and you're done the shift. And then you're like, the next morning, you're like, wow, that really is a fever. I am sick. I'm not going in today. I'm going to do the right thing. But the problem is this disease is very, very virulent. It has a high degree of contagion, rather. It's very transmissible in the earliest stages. So, the problem is you get low contact and high symptoms very early. So you can transmit this very early with very, very mild symptoms. And that's why the social distancing is so important at all times. And it's why we started to give people up front lines masks so that they can't, if they get sick over the period of time, and then they realize that they haven't put anybody else at risk. But most people just socially distance and you're good.
We're going to maintain the social distance until the next time we connect, even if it's several weeks from now. I appreciate appreciate the answer, appreciate the guidance, appreciate the thought. And I know that we'll be sharing some information that you've referenced over the course of this call as well. And we're
Okay.
recording it. We can push it out afterwards as well.
Great, thanks.
I just
Joshua.
want to
Stay
thank
safe.
I just want to thank Joshua and thank all of you for being part of our call and being part of our community. As physically distant and socially distant as we might be, it feels like in this time the community has really come together, and Joshua sort of guiding us with our leadership team and through these sessions has been a key piece of what we've been able to do. So thank you everybody for being here, and thank you so much, Joshua, for being a
My
part of this
pleasure.
community.
Absolutely. I'm proud to be part of it.
Good night, everybody.
Good night.